Did you know up to 80% of women experience vulvar or vaginal changes in menopause that affect the quality of their life, affect their relationships, and overall just bothers them? I'm Dr. Jen, a metabolic and hormone expert, double-boarded OB/GYN and integrative medicine. So I want to dive into this topic. It's just not a topic we really discuss. Certainly in Western medicine, I feel like doctors really ask the question about sexual health, which I find needs to be asked to every single woman over 40. But I want to talk a little bit more into this subject because I think it's something that women often will bring up once they're comfortable talking to their provider. And we need to talk a little bit more about those changes. So let's kind of dive into the symptoms that may occur related to that, maybe why this is happening, and some solutions. So first of all, symptoms. When estrogen and progesterone and testosterone, and primarily estrogen and testosterone, when we're talking about vulvar and vaginal changes, decline with perimenopause and menopause, several things actually happen. And most women will say, I noticed that I have some dryness issues, some burning sensation, maybe pain with intercourse, feeling like things just are different, even having more sensitivity on the external portion, which is the vulva, feeling like they can't wear tight clothing or have to change out of a bathing suit, or feeling just more irritation and irritability, even dryness on the vulva or itching on the vulva. That's actually a fairly common symptom. And certainly women notice appearance changes, the sagging of the tissue, the color changes, and just feeling like there's less moisture in general. And this is because as we have declining hormones, both estrogen and testosterone, there are estrogen and testosterone receptor or androgen receptors in the vagina. And certainly the lack of those hormones will change a couple of things. Will change the pH of the vagina. So normally the pH of the vagina is acidic and it becomes more alkaline. Two, there's less bacteria that are actually beneficial bacteria that help fight against infection. But that bacteria also is part of the vaginal microbiome that help with keeping the normal body odor, resistance to infection. And so women will notice that they have a different smell, like things just don't smell the same, or their partner may say something about things smelling differently. Even more, as those changes occur, you get more thinning of the vaginal tissues. It becomes more pale in color if you're looking on exam. And that sort of less resiliency is what women notice when they have burning or pain during intercourse, because it's just not tolerant of friction as it used to be in your 20s. And this is all related to those declining hormones that I mentioned. So what can you do about this? What is possible, or what should you be looking for? If you feel like you're having symptoms of dryness, irritation, burning, sensitivity to touch, external pain, you really need to see a doctor so that you can actually get a good pelvic exam, especially if you're having things like itching that's really uncontrollable at night. You need to really have a good exam and make sure that you don't have anything going on. And these are all just changes associated with menopause. And as far as solutions, let's talk about some of the things that you can do. So if it's changing the pH and maybe there's a body odor change, obviously you can do things like change your soaps and shampoos and mix up, looking for things that have non-toxic ingredients, trying to eliminate things with perfumes, because that can often irritate the skin that's more sensitive. You can even use a whole body deodorant. I use this one. I'm not associated with them at all. I just love the Lumi because you can actually use it anywhere. You can also use things that are more natural for just kind of lubricants in general for vaginal dryness. So you can actually use things like coconut oil or different types of sort of moisturizing options. Certainly there are things like vitamin E and hyaluronic acid that can be made into suppositories that can help with vaginal dryness. I have very commonly I prescribe a suppository that has estradiol, vitamin E, and hyaluronic acid, so it gives moisture, retains moisture, and then ultimately fixes the tissue to be a little bit healthier and more youthful. Any vaginal estrogen product, whether or not it's a ring or cream or tablet, is fantastic for menopause changes. And you can check out my video on hormone replacement therapy that goes into all the different types of hormone replacement therapy, including all those options for the vagina. You can certainly consider even using just straight beeswax that has combination of hyaluronic acid and other things that are sort of really for moisture retention. So there are a lot of different options. In fact, there are even some that are available over the counter and products that are like Remedies, which you can get, which help with that as well. Looking at the vulva, there's certainly salves like Medicine Mama makes a fantastic vulvar balm that can help with itching and irritation. You really want to make sure that you're trying to avoid harmful chemicals. You want to make sure that you're actually trying to kind of get rid of those endocrine disruptors that are in your life that can cause a lot of problems overall with making you more sensitive to medications as well. And there are things like vaginal probiotics that can bring the microbiome back to and restore the normal bacteria, and things like pH balancing gels and tablets that actually are very helpful to make the vagina more acidic if you suffer from vaginal infections and UTIs. So there are a lot of different options, and you really should talk to your healthcare provider about what's going on. Bring up this conversation. I always love when women bring in kind of a list of things that are bothering them, and then we can kind of address them one at a time and see what else we can do from a whole body perspective as well. So hopefully this is helpful for you. Hopefully this opens that dialogue with you and your provider. And let me know if you have any questions. Please like and subscribe if you like these videos.